Hello, my name is Bipin Patel. I'm the pharmacy manager at Broadway Pharmacy, Bexley Heath. I'm also the chair of the local LPC, Bexley Bromley and Greenwich LPC, and a designated member of the Pharma BBG LLP. So with the introduction of Healthera in the pharmacy, we have seen some changes in the way patients are receiving this. Where we introduced the Healthera app, patients have found it useful. They find it a good way of communicating with us, and unfortunately the way the world is, everyone's got a smartphone, so they're looking at easier ways to do it, so it gives them a more convenient way of communicating. And not only that, the benefit of the smartphone app is that it can act as a reminder, whereas before people had to have reminders in the calendars. With this way, the smartphone will act as a reminder for them, tell them exactly what they need to do, when they need to order it. And the beauty of it is that once the message is gone, they will get a response back from the pharmacy when their request has been processed. Other than that, we've found it beneficial in the sense that the team is a bit more receptive to what's happening, because they find it an easier way to manage the patients. But also with the automated features in the Healthera app, the messages can be sent directly to the surgery, and you can monitor the progress of it, and at each stage you can keep the patient informed as to where the request is and where the process is. And the beauty is, once you've completed the prescription, you can actually earmark it or annotate it so that the patient knows that the prescription is ready for pickup from the pharmacy. So there are lots of benefit, but I think the overall benefit is that we're able to offer patients an additional way of managing their prescription, which is what we should be doing, which is what pharmacists do. Our job is to help patients look after their medicines, and this is a tool that makes it easier for them, in my opinion. And I think it's something and that's why we've decided to partner with Healthera, because I can see that this is only going to grow, and the demand and uptake is going to be greater as time goes on. As things are going, everything is getting digitalized, so everything that we do is, everyone wants things done quicker. Overall, everything is now being digitalized, everything's at the end of it on a smartphone. And by partnering with Healthera and thinking of pharmacy as a whole, I can see that we're going to have robots in pharmacies sooner or later. You're going to have apps controlling all different things. You'll have apps for patient apps. There are already patient apps with access to GP services. So this is another way of patient accessing pharmacy services. And to my way of thinking, that this is the way ahead. So in 5 to 10 years' time, I can see that apps is going to be at the front of whatever we do. And to partner with a company that's got a good sound base, they've got a good platform, and overall it's got good information governance, so at least you know that the patient information is never going to go astray. It's got good encryption, so it does things properly. And really, to be with them from day one is a way of actually also trying to see how we can develop and see what benefits pharmacy overall. So to have an input into the development of the thing as well, to some extent. And I can only see improvements and benefits in partnering with Healthera. Practicing for over 35 years in the community, and we've got a good name, and we're careful about who we partner with, and offering the Healthera app as a means for our patients to manage their prescriptions is a natural progression for us, because I can see that it's a robust system, it's a robust way of doing things, and we didn't want to partner with anyone else, in the sense that we only want to partner with people that are going to offer the same sort of service levels as what we're used to. To me, it's just a progression, and partnering them is the way that we should be looking to, is a natural progression for me. So I can see that with time we'll be using their logos and stuff on our marketing material, to be promoting the app for us and actually creating an identity that Broadway Pharmacy is working with Healthera to manage patients' repeat prescriptions. Working with Healthera, we found it very easy. There's good backup, good support. We have our own personal contact with Healthera. I can contact any time of the day and get a feedback. And fortunately for us, the back office functions of Healthera is fairly straightforward, and with very little training, anyone can manage the Healthera the desktop module. It doesn't take an awful lot of management. Anyone with the basic IT skills is able to work their way around it. So we've had a patient with a slight issue. They couldn't get the app to work. An email to the support team, and everything was sorted out within an hour or a couple of hours. So the back office functions are very easily managed, and the support is very good as well. Overall, I feel that Healthera is one that we made a good choice in partnering with Healthera, and I can only see the relationship building further and further. And then the beauty of all of this is that there's functions on there that we don't even fully use, but you can actually market to your patients if you needed to. You can send messages there. So obviously during flu season, you could send a message to say, we're doing flu season now, you can make your appointments, or they can book appointments through the Healthera app. So there's lots of functions, and in due time, the more we use, you find that more and more patient loyalty will build up, because patients will expect to see those things, and it becomes a natural progression. It becomes second nature to talk to the pharmacy through the app. So I can just see a relationship building, getting stronger and more fruitful for both of us. My name is Bipin Patel, and I'm a proud Healthera partner.